Hi, thanks for joining us on Celebrating Act Two Gray Matters. This is
Oh,
where Art and I opine and maybe whine a little bit
on
about
gray? On
anything
gray?
of interest to people with gray. Yeah, with
Hey,
gray.
yeah, I noticed on gray matters, my eyebrows are still pretty dark, and I don't do anything with them. I
Yeah.
wonder if there's,
You
maybe
don't
we could do
color
a
them?
whole topic on that once.
Why do men's beards have different colors in them? That's another
I
question.
don't know. Well,
Yeah.
this is like a little bald spot on my chin. And by the way, I have a special little turkey guy down here. I had an implant to make sure that I would still have this because
Oh,
my
that's
little
good.
grandkids
When you
really
lost
like
weight,
it.
you wanted to keep that waddle. That's important. Yeah. Otherwise, people might think you're younger. We can't have
Right.
that. Yeah. So, Art, today, let's talk about our physical therapy.
Yes,
A
both
lot of
of
people
us.
don't know that when you hit whatever it is, 65, and you get Medicare, you can get physical therapy if your doctor prescribes it for you.
Right.
And Medicare will pay for it, again, mostly depending on the plans you have, right?
Yeah, actually, just as a general rule, the supplements which you pay a lot more for are generally covered for 100%, and Advantage plans may have a copay, but if the copay could be 10 or 15 bucks, so it's not expensive if you have something. Look, one of the things is we both know this, John, as we get older, and we've traveled this road before, many of you, or some are still traveling with us, is that I'm very active in the gym, you're very active in your garden, John, but still muscles tend to atrophy. We don't use them the same way that we use them when we're younger. And so
Right.
no matter what happens, unless you can really keep up, your balance suffers a little bit. Sometimes you don't raise your legs as much as you used to, and you trip over very small items. So, all of us tend to need to pay attention to these things. But I've been just finished about 11 to 12 weeks of physical therapy because after my gallbladder surgery, I lost a lot of muscle strength, and I noticed in Tai Chi I wasn't holding poses the same way I used to, and my balance was off a little bit. And I went to see a neurologist, although my regular primary care physician could have ordered it. He actually ordered that I go see a neurologist to make sure there was no other issues. And she got me to physical therapy, and it has done wonders.
Yeah.
I've gone every week for about 11 weeks, and I'm pretty much back to where I was before the surgery. And I got double whammy because about 3 weeks after I started working out again after the surgery, after about a month, I got hit with flu A that put me down for the count for 3 weeks. So it
Right.
just knocked the crap out of me. And
Yeah.
but physical therapy is part of Medicare, and you shouldn't overlook it. John, you've had some experience with it as well, haven't you?
Right. I was in the hospital earlier this year, and let me just get rid of my phone call here. Thank you very much. I was in the hospital earlier this year and was laid up for 6 weeks.
Mm,
And during that time, they gave me physical therapy, occupational therapy, and quite frankly, a lot of medical care as well.
mm,
But coming out of the hospital, renewing all my regular doctor's relationships, I was assigned, I guess they call it outpatient physical
yeah.
therapy, which is where I am now. So when you're in essentially bedridden or close to it for 6 weeks, 6 to 8 weeks, um, as you said, your muscles atrophy. I had trouble walking. I was on a walker for a while, and physical therapy helped tremendously with that. Going up steps. Now my physical therapy is a lot different. It's helping me really get up off the floor and
Huh.
bending, getting down.
Wait,
Because after
I've
all,
fallen and I can't get up. Was that you?
well, that's a real syndrome that
Mm,
we older folks have to worry about. So my physical therapy is focusing on that these days, don't have occupational therapy anymore. I'm not sure of the difference. But I also know that Medicare will cover chiropractic. So if your physical therapy is muscles, chiropractor is your spine and your bones.
Mm.
And if you have ailments, as everybody over 50 does, you really need to talk to your doctor and see if some kind of physical therapy or maybe chiropractic will help you. And he can make that prescription. Medicare will look at it and approve it, generally speaking.
Mm. Yeah. So, by the way, speaking of which, I'm so first of all uh, uh, the physical therapy that I'm associated with is part of Mission Hospital in Mission Viejo, California, a group called Providence, and they have about 6 or 7 full-time therapists, and these therapists actually have doctorates. As my therapist likes to tell me, with the lowest paid doctorate holders of all of them, but she loves her work. She loves helping people. And I've heard when I go for my 45 minutes to an hour session every week, I hear the other therapists working with the other people. They really care about what they're doing. They really get into the nuance of what to do. We have home exercises that I get to do every day. And they even gave me, in my case, a little app for that. And so every day I go through about 10 or 12 of these exercises. It's not just going in once a week. And today, which is my last session, as a matter of fact, for lower back and my hip, and there was significant improvement. Um, I realized that another thing that before my surgery is I had just started walking up and down stairs with no pain in my knees and without holding on. And that all went to hell with the lack of exercise for many, many weeks. And I'm probably going to be able to get authorization to go in to do special strengthening for my knees. Because if I can walk up 4 or 5 stairs without any pain, it means there's probably not arthritis or some other new knee replacement need. It's probably something that can be taken care of. Also, I've changed my diet so I have less inflammatory things like oils and things that cause inflammation in the joints. But definitely getting more strength around my knees, and that's a physical therapy kind of thing that they can work with. So I'll be going back and looking for that. But Medicare covers it. That's the important thing. And if you are finding any problem either with balance or not being able to get up from the floor, and you don't want to get the little thing with the push button, John, you're a gardener. You're constantly on the ground and having to get up. So that's really important for you.
Yeah, yeah. Well, here's the takeaway for everybody, and that is your doctor is the key to getting Medicare benefits of any kind. Make sure your doctor prescribes it. And if it's therapy, whether it's occupational therapy, physical therapy, or chiropractic, or anything else, go to your doctor first, get him to examine you and agree that this is what you need. He can prescribe it, and chances are that Medicare will cover it. So good luck. Don't just walk around like an old person. Get better with every opportunity you can.
I remember, if you've fallen, you can get up.
That's right.
If you have therapy.
For more on Celebrating Act Two, visit our webpage, follow us on Facebook, subscribe to us on YouTube, and tell your friends. Celebrating Act Two is the user manual for the second half of your life.